Hi, everybody. Good afternoon. Welcome to the Behavioral Health Facilities NOFA Technical Assistance Session. My name is Chrissy Grover-Roybal. I am the Deputy Director of the Snohomish County Office of Recovery and Resilience. We are the office tasked with distributing and managing the $160 million of federal funding coming through the American Rescue Plan Act, designed to help local government and communities move beyond COVID-19 and build resilience in their communities. This funding opportunity is funded through that. Today, we will be recording this session. It will be available online. I have a PowerPoint presentation that I will share with everybody, and then we will have an opportunity for questions and answers. Please feel free to either drop any questions in the chat or hold until we get to the very end, just for the sake of consistency between this and the previous presentation. We want to hold all questions in the end, and they will be added to a question and answer document that we are posting online so that folks who attended session 1 can see what was discussed and shared in session 2. All right. And with that, I will share my screen. Okay. All right. Thank you, and thank you all for attending today. I hope that it's going to be interesting and useful. Please type your name and agency in the chat for attendance purposes. And also, if you would like to be added to our general Office of Recovery mailing list, which has information on any future funding opportunities, please include contact information. This PowerPoint deck is already posted on the ORR Housing and Behavioral Health webpage. As I said, this session will be recorded, and this recording and the live Q&A document will be updated and posted on the Office of Recovery and Resilience Housing and Behavioral Health webpage within 5 business days. During today's presentation, we will go over some general information about the Office of Recovery and Resilience, look at the timeline for this funding opportunity, talk through what this NOFA is intended to fund, review eligible and ineligible activities, talk about eligible applicants, so that's who can apply, and go through specific rating criteria to help you understand what are the types of projects that we're planning or anticipating will be highly competitive, and which projects are less likely to kind of rise to the top of the projects that we will fund. Next, we'll go through the application itself, reviewing the application checklist, steps to submit your application, what happens after submissions, and general tips related to submitting an application that will be reviewed by the panel. And finally, we'll give you an opportunity to provide questions and answers. This session is generally focused on kind of broader questions that are more universally applicable to respondents. If you have questions about your specific project, you're more than welcome to answer them, but we may not be able to give you a concrete answer today, depending on the level of specificity that you're asking for. So we may just need to follow up with you, depending on the type of question that you have. That not to say that you shouldn't be asking those questions. Please share any specific questions that you have, and we will do our best to answer them today, but may need some follow-up. So the Office of Recovery and Resilience was started back in the summer of 2021 by Executive Dave Summers and the County Council. And as I said, the mission of the office and purpose of the office is to oversee this $160 million of federal funding that was allocated to help the county recover and build resiliency after the COVID-19 pandemic. The funding comes through the American Rescue Plan Act, which has some very specific requirements built into the legislation that passed the money. The funding can be used to address COVID-19 response, replace lost revenue for governments, the way that Snohomish County is prioritizing it is really these second two pieces, is supporting immediate economic stabilization. So that is the kind of immediate recovery piece, and then addressing systemic social and economic challenges that contribute to unequal impact of the pandemic. That's the resilience side of things. So really, we have, for the most part, transitioned from kind of addressing the immediate impacts caused by COVID-19 and are really looking forward to what kind of legacy can we leave in the county using this one-time funding. And that's part of the intent of this funding opportunity, especially, is to really say, we have this one-time large amount of money. What is the greatest good that we can do to leave a lasting impact and legacy in the county? The funding, as I said, is one time. We will not be getting this opportunity again, so we're trying to be very judicious in how we're spending it. It must be contracted by the end of 2024 and spent by the end of 2026. So this is really an opportunity to do a lot of good immediately. We're trying to get this out into the community, helping people as quickly as we can. So with this funding opportunity, we announced the NOFA at the end of November 30th. We've held one application workshop already. This is our second application workshop. The application deadline is January 27th at 4 p.m. Within the first quarter, so by the end of March, both the Office of Recovery and the Human Services Department will review for eligibility, as well as ranking and identifying recommended projects for funding. We anticipate planned award notification will happen also in that first quarter, and contract negotiations beginning shortly after that. What does the NOFA fund? So we are looking at behavioral health facilities capital projects. This NOFA will not be funding any direct services or things along those lines. It's really focused on the capital side of things, and all projects must expand or establish new behavioral health capacity in Snohomish County, and that's specifically licensed behavioral health capacity. In addition to kind of that bare minimum requirement, we have some priority points, and I'll be going into more of these later, but we are giving additional points to projects that primarily serve individuals who are using Medicaid or are Medicaid eligible, and also giving additional points to programs that primarily serve low and moderate income participants. Those are defined as families at or below 65% of area median income. We have tables that can help you understand what that cutoff is. The types of projects we anticipate that we know are eligible and anticipate funding are, for example, building a new behavioral health facility, adding rooms in an existing facility to increase the capacity of that facility to allow them to serve additional people, or partnering with a government or private business or existing building to convert that unused space into a behavioral health facility. So not breaking new ground, but taking an existing unused building and transitioning it to a behavioral health facility. And again, that is not an exhaustive list, just some examples of the types of projects that are eligible. For this, we are awarding projects from a minimum $500,000 up to $4 million. The strings attached to this, as it is federal funding, are pretty comprehensive and robust and time consuming. So we want to make sure that the types of projects that we're funding, make it worth it for our partner, essentially, to kind of go down the journey of federal eligibility and with us. This is an open and competitive funding process, and we anticipate that we will get significantly more requests for funding than we have funding available. So we anticipate this will be a fairly competitive process, and many applications won't get funded. We will obviously fund as many as we can that are good, high quality projects. And all sites must be located within Snohomish County limits. Applicant eligibility requirements. So in order to be an eligible applicant, you or a combination of applicants who are applying together must meet all of the following requirements. Applicants must either be a nonprofit, for-profit organization, local government, or a tribe. Applicants must obtain and maintain licensure and certification for the proposed facility and behavioral health services provided at the facility through all applicable licensing bodies. Applicant must have previous experience in delivering the proposed service or similar service. This is not an opportunity for individuals who are interested in starting a new organization or branching out into a new type of service. We are really looking to build capacity for organizations that have a demonstrated track record of success and experience in the behavioral health program that they're currently running. Nonprofit and for-profit business applicants must be licensed, report and pay revenue taxes to the Washington State Business License, and have any licenses required by the laws of their jurisdiction. Applicants must have a federal tax ID number, employer identification number. And finally, all applicants must be able to spend all funding by the end of 2026. That is a requirement of this money. If we don't spend it by 2026, we will lose it. And that is a key priority for the Office of Recovery and Resilience, as well as the county writ large. So those were the requirements for all eligible applicants. In terms of project eligibility requirements, all projects, as I said, must be located in Snohomish County, and funded projects must result in an increase in capacity for behavioral health care. And here are a number of types of behavioral health care. This is not an exhaustive list, but merely a list of potential avenues that we would be supporting through this funding. Additionally, projects must meet all zoning requirements of the jurisdiction in which the project is located or have a zoning variance already in hand. Project activities must meet the definition of eligible activities, which we'll go into in a little bit. The proposal must demonstrate that the agency has the legal authority to undertake the proposed project by meeting the site control requirements. So you must have site control. Recipients of funds are required to pay state prevailing wages for all capital related activities. Providers applying for other funds are eligible, but duplicative funding is not allowed. So if you have multiple sources of funding that are going to support this project, we'll just need to, you must demonstrate that what you're requesting, ARPA funds, is not already covered by other federal sources or anything along those lines. And recipient must dedicate improved facilities to behavioral health operations for 20 years after project completion. So there is a fairly long tail in terms of how long the program must be operating. In terms of eligible activities, so what are if you're an eligible applicant, you've got an eligible project, what are the specific things that this funding can provide for you? Any construction, renovation, or rehabilitation of facilities that increases the capacity for behavioral health services or establishes new capacity. And that can include building something from the ground up or substantially remodeling existing buildings. Soft costs are eligible, which includes, but is not limited to, design, project management, permitting costs, the purchase of equipment or furniture that is not permanently affixed to the property. Acquisition costs may be considered an eligible funding activity if you can demonstrate that you have fully secured enough funding to complete any additional rehabilitation work necessary to increase behavioral health capacity. So we're looking really to make sure that you have a full project plan kind of from wherever you are today all the way to the end. And with the addition of this funding, we can be reasonably certain that this will result in a completed project. If the project serves multiple uses, only activities and costs directly related to increasing behavioral health capacity are eligible for funding. This is a question that has come up a couple of times through our email and other FAQs. But if you're interested in purchasing a large parcel of land and building something, and only a portion of that is related to the behavioral health facility, only that portion that is directly related. So the construction of that one individual room or kind of whatever portion of the total parcel is going to be behavioral health, increased behavioral health capacity is going to be allowable and eligible and an eligible expense under this funding opportunity. In terms of ineligible activities, through this, we will not be funding any deferred maintenance or repairs that do not directly contribute to increasing capacity for behavioral health services. We will not be providing any fundraising costs, and we will not be paying for any agency staff time. In terms of how the funding, the points are going to be awarded, we're looking at organizational capacity, that's 10 points. And within that, there are two categories: a history of project management. So organizations can demonstrate the ability to successfully implement and manage federally funded projects in a timely manner. So that means a history of implementing these federal projects, and demonstrated financial management capacity. So the organization has appropriate financial management capacity as indicated by audited financial statements. And you can review the application to see the specific questions that we're asking. And I do want to pause and say, we'll be looking at all of these applications holistically and awarding individual points to each question. So even if your organization doesn't score full points in one area, if you have a strong application in other pieces, I strongly encourage you to apply. None of these are at least within the funding points, if you don't meet one of them, you're not automatically kicked out. We'll be looking at all of the questions together and awarding points that way. Readiness to proceed is a high priority for the Office of Recovery and Resilience, again, because of that looming 2026 deadline. We really are looking for projects that are, what we call shovel ready, so that we can reasonably anticipate that your organization has a plan to fully expend the money and successfully establish new behavioral health capacity in a very short timeline. So that is within a couple different areas. One, the ability to meet pre-contract obligations. So that means you're able to provide meet all of the environmental requirements, address any land use issues, have fully thought through acquisition or relocation requirements, identified other committed funding sources, et cetera. But effectively, you have a project that is well thought out, has already gone through permitting processes, maybe environmental review started, but you're really kind of moving forward with this. Project timeline is a huge part. So again, looking at whether or not this project is shovel ready and the organization is ready to obligate funds by September 2024 and complete project by December 2026. We are looking at work you intended, your plan for, or work you've already done related to environmental and land use issues, so that you've demonstrated that you've already thought through any potential delays related to environmental and land use issues, and additional funding, really looking for a clear, documented, and fully funded budget that demonstrates support from additional resources. So although not a requirement, we are looking for projects that are maybe braiding together different types of funding, or kind of have other support and just need a little additional funding from the ARPA money to either push you across the finish line or maybe slightly expand the project or something along those lines. And again, these are all pieces of a whole. So if you don't necessarily meet one of these, that doesn't make you ineligible. It just means in that one area, you may get fewer points. We're looking at project soundness, so that you've done your due diligence to look at all geographically or functionally related parts of the project, and see how this fits into whatever you're asking for the ARPA funding, fits into the broader project plan that you may have. the anticipated impact once the project is complete. Will you directly contribute to a net increase in behavioral health capacity provided by your organization? And then is your budget reasonable and well supported or justified? Are your forms consistent or accurate? Again, really kind of looking at how well you have thought about or planned for this project. And finally, the last piece is looking at the community need and benefit. And that's two pieces. One, how your organization thinks about providing culturally relevant services. So are you able to demonstrate how racial equity is incorporated into your work and provides specific examples of existing policies and practices that demonstrates a commitment to racial equity? And then that last piece, are you serving individuals most impacted by COVID-19? And then this piece is worth up to 10 points. So that is, you get 5 points if the project is serving individuals who are using Medicaid or may qualify for Medicaid. And additionally, there is an additional 5 points if the project will primarily serve individuals at or below 65% AMI. For either of these, obviously, if you meet the first criteria that you're serving individuals who are using Medicaid, you meet the second criteria, so you get 10 points because the Medicaid cutoff is below 65% AMI. So those are kind of intertwined. In terms of what that threshold is, we've provided this chart, and for the 65% AMI, it's this fourth column right here under impacted. So you can see the size of the household and what the income eligibility is for that. So in order to be eligible, we would like you to submit a complete application. We put together a checklist. Within that, you'll need to provide an applicant authorization and complete the application questions sections 1 through 4. You'll need to provide a project budget form. And if you're a nonprofit organization, a government, or municipal corporation, you will need to provide a copy of board minutes or city council minutes or a resolution that approves the submission of the application for funding. If you will not be able to get that by the 27th, which is when this is due, please email Robbie, and her email is located in the application, just to let us know, that you're not going to be able to do that, and let us know the timeline with which you'll be able to send that to us. We recognize that, sometimes it can be difficult to get on a city council agenda, and, don't want the slow bureaucratic process to hamper your ability to submit that application. So just let us know if that's going to be an issue for you, but do let us know sooner rather than later so that we can prepare for that. For nonprofit and for-profit organizations must complete the organizational document certification and email this list of documents to us at OCHS mailbox at co.snohomish.wa.us. And this is just documentation that talks through your eligibility to conduct business and provides us some information to your organization. So it's a proof of 501c3 status if you're a nonprofit, current articles of incorporation and amendments, current bylaws, and that's all for nonprofits. For for-profit organizations, you must provide an IRS notification tax letter, Washington State Secretary, a state certification of ownership. And then for all organizations, a mission statement, length of time in existence, ownership structure, board of directors information or other governing bodies, an org chart, management team information, operating budget for your current year, 2 years of audits with management letters or financial statements, tax returns for the last 2 years. And again, make sure that you review and sign the organizational document certification form, which is located in the application. That outlines all of the individual documents that we will need. Additionally, applicants must include evidence of site control. And then if you have any additional funding that is contributing, letters of funding commitment, architectural drawings, construction specs, title report, appraisals, cost estimate, relocation plan, and either a copy of your state issued license that demonstrates qualification to provide behavioral health services, or a plan outlining key activities toward licensing once you've completed this capital project. But really anything that can help us better understand your plan, your vision, and what work's already been done, or how much what you've already put into kind of ensuring that this is a high quality project that will be successful and have a positive impact in the community. There is also an environmental supplemental application. In the application, there is an application checklist and with a list of all the supporting documentation. Please review that. You'll need to provide a copy of the Thomas Guide or a similar map with a site location clearly marked, the assessor property record, unanticipated discovery plan if the project includes any ground disturbance of any kind, a FEMA flood map, an EPA map with a site location clearly marked, Department of Ecology map with a site location marked, and a map showing the specific measurements of the site. We've included those links so that you can kind of go and capture just the images of your site location to demonstrate your location in those contexts. We'll need a signed zoning confirmation letter if the project requires a zoning change or variance, a detailed history of property use, any available project and site studies, photographs or aerial photos of the existing site, site plans and drawings. And then if available, your environmental site assessment for the acquisition of land, new construction or substantial rehabilitation, and a hazardous material survey or assessment summary if applicable. To submit your application, please submit one original completed application with all attachments and one hard copy. So that's 2 physical copies, as well as an electronic copy on a USB drive to the Snohomish County Human Services Department, Office of Housing and Community Development. The address is there. Additionally, you will need to email us with the organizational document certification form, which is attachment C in the application, with all appropriate documents to that mailbox that we have. And please make sure that you ideally in the documents themselves, but if not, at least in the email, make it clear which organization these documents are tied to and which application form, just so that we can track everything. Applicants must submit these copies of the NOFA application in person or by US mail, FedEx, or UPS, however, by Friday, January 27th by 4 p.m. And that is just to make sure that we are meeting the deadline. If you have any concerns or questions or anything along those lines, please reach out to us, but really recommend that you don't wait until the last minute to submit all of these things. What happens after submission? OHCD staff will complete an eligibility review and ORR review team, which will be comprised of executive staff in Snohomish County, staff from Office of Recovery, staff from the Human Services Department, and potentially some external partners will receive copies of the project materials, the compliance and feasibility summaries, and the threshold review. As a group, we will rate each project individually and then develop a prioritized list of funding recommendations to send to Snohomish County Council for approval. And then County Council will make the final funding awards. Please follow the required format throughout the document. Throughout the application, there are just limitations on page size and font and things like that. Please follow the required format. As you're answering questions, you don't need to retype the questions or the rating criteria. Just respond in narrative form. Be specific and answer all parts of the questions. I would say that's where I see folks struggle a little bit is they'll answer one part of the question and then either not fully read it or not get to kind of the other pieces. And then even though they would likely have been more successful at the question because they don't answer all of the pieces, we can't award them full points. use the scoring criteria. In the application, we have provided kind of what a 5-point answer would look like, and what a 3-point answer looks like, and what a 0-point answer looks like. Definitely go back and review those, because that's going to let you know what specifically we're looking for, and also you can kind of benchmark and see where your project might fall in terms of what a competitive project looks like. Double check your budget numbers, use Excel. That's something that we absolutely will be looking at. We want to make sure that kind of everything that you've put together aligns with everything that you're sending to us. Have someone else review your application. It's always good to get a second set of eyes. A lot of times, you know, you're deep in these projects and you know all of the ins and outs, but we only have the context that you share with us. So make sure that kind of all of the information that you want to get shared gets communicated, and oftentimes a kind of a second review from someone that's not putting it together can be helpful to get that gut check. Start early and allow lots of time for submission process. And please use the attachment 1 application submission checklist to make sure that you're hitting kind of all of those key pieces of documentation that we're looking for. If you have questions, obviously you can ask them today, or if you're looking for help, you can also reach out to us at snohomishcounty.recovers@snoco.org. We have a Q&A that we are updating as we get questions, both through these sessions and also in our inbox. And that's posted on our housing and behavioral health page. Only written answers can be officially considered, or can be considered official responses. So, you know, if you talk to any of us on the phone, also make sure that we can get it in writing and add that to the Q&A. All right. And with that, I will stop sharing and start going through the chat to see if there are any questions. Okay, I see from Evie, we have, can quality of service be considered, for example, providing lab services in-house, which could increase program compliance? And I would say if what you're thinking of isn't explicitly kind of called out in the questions, it's not going to be something that will weigh in terms of scoring. Cami, did you have anything that you wanted to add to that?
No, I agree with your thoughts, Christy, as well. This application is really for the capital side of the service delivery, not so much not looking at so much the quality of the services that will potentially be provided in that facility.
Thank you, Cami. And I see, Chris, you've got a hand.
Hello, yes. So one of the requirement is about the zoning. For some of the type of zonings for behavioral health facilities, some of the zoning doesn't exist. So we know, because we have worked at a project that was in King County, and we had to go through an hearing examiner for that. So how would we address that? For there will usually be projects that have either commercial or industrial zoning, but not very specific zoning for some of the behavioral health projects.
Robbie, can you answer that question, please?
Certainly. Can you please, I'm sorry, I was listening to that and I was trying to work through it. But I think I lost it after you said you had zoning in King County. So
Yeah.
Can you please repeat that?
For some of the behavioral health facility types, the zoning in cities doesn't exist, and applications that organizations have to go through a hearing examiner for a conditional use permits.
Correct.
So if the zoning doesn't exist currently, how can we demonstrate that we already have the zoning for a facility because the timeline is very short?
You would need to reach out to, if it's the city or the county who has jurisdiction of the zoning for that particular area where you're planning on having your facility. And you're going to have to get a letter from the zoning department that you are being reviewed for conditional zoning, or that the zoning is a possibility. That is something that is required that we would need to see, or at least something stating that it is being worked on and looked at.
Okay, okay.
Okay, I know it's kind of tricky when you're starting to move into a different area and you only have conditional use. But that is something that we do see often with capital projects. So you would need to get some verification that you have conditional zoning or that you are working on getting conditional zoning.
So because another question that I have is because it also requires either site control, or maybe we can provide some kind of indication that we're working on achieving site control for a certain location, and we're working on that application. Does that also is a valid response?
You would actually need to have site control in the form of a purchase sell agreement or in a long-term lease.
Okay.
Or if you were obtaining this funding to purchase the property, let's say you're applying for $500,000 to actually purchase the property, then you would need to have some type of agreement in place for that.
Okay.
And then everything just closes on at the same time, because
Okay.
that would show site control.
Okay. Okay. And would Snohomish County be the one that will be handling escrow for the organization, or would the organization be doing that?
The organization would be handling escrow, and then Snohomish County would be working with whomever the escrow company was.
Okay. All right. Thank you.
Thank you, Ravi. From Mara, we are looking for capital funds to support the increase for capacity to house sponsors for behavioral health services within schools through school-based health centers. Does this count? And I will pass that to Cami.
All right, so Mara, let me know if I'm not fully understanding your question, but you're asking if these dollars could be used to create or remodel structures to support school-based behavioral health clinics.
That is correct. So it will be a behavioral health clinic within a school-based health center. And so we are looking at purchasing relocatables to put on our school sites to be able to do that.
And so then a portion of that portable would be designated used for behavioral health services.
Correct.
I totally support the model of school-based clinics for both medical and mental health, physical, behavioral health issues. I'm not sure about the purchase of portables with these ARPA dollars. That's sort of falls outside what we've been talking about internally. So I'm going to defer to Chrissy and Roby perhaps on that piece.
Hi, Cami. I'll take this one. Hi, Mara, it's Robbie. So part of the problem with capital projects is, you've got that long-term 20-year use agreement. And so you really need to have a solid foundation. The other situation that comes up when you're working with school districts is they may not agree to having a deed of trust for 20 years placed on their property. So even if a portable has some type of foundation but is sitting on school property, the school would still have to be encumbered. And so that can run into a lot of problems also. But I agree with Cami that those are fantastic models. Unfortunately, this type of funding is not necessarily the easiest to use with that model.
So it would have to be a full-on either restructuring something within our existing school or in addition to the building.
It may not necessarily be able to cover an addition to the building, only because the school district And if the school district applied, it would be one thing. So the school district could apply and say, you know, we want to apply, we want to expand behavioral health, but it would have to be used for that purpose, or it would only fund a portion of whatever that was, and then it would have to be encumbered by a deed of trust and a promissory note and everything that goes with a capital project. So they couldn't say 5 years from now, say, you know what, we need an additional classroom and we're going to move whatever
it.
we're using this area for. So school districts are hard because they have so many of their own underlying requirements as well. So it's not undoable. It's just, it would be very complicated to do it.
Okay, so then a few other questions, if I may. If we already have board minutes that approves this general project, is that enough rather than the application itself?
You would need to attach that to the application, but you have to, an application has to be complete with all documentation in order to even be complete. So if we start going through an application and it's missing documentation, it's considered incomplete, and we don't review it. We stop reviewing the application. So the general board minutes is fine for the approval that's required, but the application itself and all the required documents have to be attached as well.
Yes, of course. Okay. And I think you answered my relocatable question. And then the other one, our project is to add relocatable structures or maybe look at other options for different high school campuses in 23 and 24. On our side, if we were to submit this as a project of 2 phases, could we do it under one application, or would we have to consider 2 applications?
Chrissy, did you want me to take that?
Yes, please, Robbie.
If it's the school district applying, then the school district could complete the application and explain that it would be completed in 2 phases, but you would need to have a budget for each of the phases.
Okay,
And then you would have to have site control for each of the phases as well.
perfect. Thank you.
Thank you.
And then I think my last one is already somewhat answered, but I'll ask it just for the sake of asking. If the site is already developed, there's no deep foundation already required because we're going to be putting a relocatable on the ground. Is there a need for an unanticipated discovery plan?
I can answer that because we're currently going through that with another very similar project, and the answer is yes.
Okay, thank you so much.
Mhm. And we're happy to work through the ADPs with people also.
Okay, thank you so much.
Excellent. A question from Sherry: would a mobile behavioral health project be eligible for funding, or is this only brick and mortar projects? And I'll pass that to Robbie.
Just like the relocatables, you really need to have these on a foundation, and they really need to be able to withstand a minimum of 20 years of use. So portable, relocatable would be very tricky to be able to use this funding for. We're really looking for brick and mortar here.
Okay, thank you.
Excellent. Another question from Sherry. Can you please define agency staffing? Does this apply to the agency applying, for example, the city of Snohomish, or does this include clinical behavioral health staffing as well? I think I can try to answer this, and then Robbie and Cami, please feel free to jump in. Through this project, we really are only paying for costs associated with the development of the capital structure. So any clinical or behavioral health staffing is very unlikely related to the actual construction and would thus be ineligible for funding. Sherry, if you have a specific example of why you would need clinical or behavioral health staffing for kind of the capital side of things, feel free to clarify, but that's my understanding.
Nope, that's exactly what I was looking for, that clarification there. Thank you.
Okay, thank you so much. Jacob, seeking clarity on the lab question. Would the creation of a lab be considered if the justification is to provide higher quality care and compliance for behavioral health services? And Cami, I'll let you answer that.
Sure, thanks, Chrissy. Jacob, as far as the creating a lab within the behavioral health facility, that could certainly, I'm sure, increase timely care, getting lab work back in a timely manner. But again, this RFP is focused on the capital side of the house, not the service delivery side of the house. This RFP or this NOFA is asking for services that can be licensed or are licensed under the State Department of Health, but we're not specifically diving into the components of those services. Does that make sense? We're really focused on the structure that will house the services, but not the details of the services that will be provided within that structure. Does that make sense, or do you have a follow-up?
Yeah, no, thanks for chiming in. Yeah, we're looking at acquisition, and so we're looking at properties, and so all the things running through my mind. So yeah, that makes sense. And I guess I wanted to clarify that too, because we're going to be incorporating psychiatric level care. So what about things like that are underserved, like electroconvulsive therapy that's used to treat treatment resistant depression? It's not I guess listed as a behavioral health agency thing, but
well, again, this RFP is focused on the structure, not so much the services that will go inside. The RFP or will be delivered within that structure. The RFP does outline that the target population is Medicaid eligible. Yep. So I would ask myself, is that a Medicaid reimbursable service? But is that a service that, the state's going to license you to provide? But again, this RFP is not as so much focused on the actual service, other than that it can be licensed or is currently licensed through the state. Yeah. Because the state will provide the licensure, not the county. And the state and the feds will be paying the reimbursement to the providers, not the county.
Right. So yeah, I guess when I'm thinking about this, if I'm going to run IOP out of one part of the facility, but I'm going to run ECT or TMS, which are procedures, when I'm asking for the money, do I leave out the portion for the ECT, or do I wrap it all under one thing as far as acquiring the building?
I would look to what your license from the Department of Health would guide that question.
Okay.
Yeah.
Thank you.
Yeah.
Thank you, Cami. I'm from Providence General Foundation. We are at the very beginning of a behavioral health capital project and just starting to seek funding. Can we request funding for the total project cost if it is under $4 million, not knowing if we will be able to secure the remaining funds? And is your plan to award the amount requested for application, or is it possible that the final award decisions would be awarding only a portion of the funding for a project? Robbie, can you answer that one?
Certainly. So when we ask for the budgets, we ask for the total development cost. And when we're reviewing applications that are submitted to determine if they will be eligible and solid projects that we want to move forward with, we are going to take a look to see how many dollars are already committed and available to the project. We're going to take a look and see if the project is going to be able to be committed and funded per our deadlines. And so projects that are potentially just looking for capital dollars will really need to take a look at your project schedule and determine if you think you can move forward with these dollars and get these dollars spent. So for example, if you have total development costs of $6 million, but the acquisition of land may only be $2 million, and you want to specifically use this funding for the acquisition, that could be possible. If you've already got, say, a $3 million building that's going to require $2 million, and being able to get the infrastructure in place, get the building ready for use, and you're not going to have those funds available, this is probably not the best use for that. This is specifically for capital. And I just want to clarify, just based on some of the questions that are being asked, in regards to the services section, when you're asking for these dollars, keep in mind that if you have a current facility, you want to think about it as, okay, can I use this funding to maybe create a larger space so that we have more room to serve more clients? Or is this something where we can purchase a brick and mortar property where we can get people in? Because we've had one of these sessions before, one of the biggest questions we get is, well, we want to have more services and we want to use the funding for services. And again, you need to think about it as, hey, if we apply for $1 million, we could add on 6 additional rooms for treatment. So that's kind of the difference between, can it be used for services and how can we make this work for services? You can build on so that you can have more space for services or treatments. I hope that helps a little, because I was listening. Cami, thank you for your explanation, because that I think really helps also with what we're trying to do.
Thanks, Robbie, for the clarification. Yep.
Thank you both. And then also, yes, the Office of Recovery reserves the right to award partial funds. So there may be situations where an application is coming in for the full cost of the project, and we opt to award only a portion of it. Edmund is asking, we are a newly constructed 36-bed residential substance use disorder program located in Smoky Point that opened within the last year. The full cost of the project was $5.25 million. Would this NOFA funding be able to be used to pay for a portion of our construction costs? And Edmund, I imagine these are costs that you've already paid for.
Well, the building we have a sort of unique partnership with the contractor that purchased the building. So we're kind of in the process of paying them back through a lease arrangement. So we've not fully paid for them yet, but they have been paid for. And there's an understanding that through the lease agreement, we will continue to move forward with this repayment. But we as an organization, Holman Recovery Center, has not fully paid for the cost of the construction yet as an entity ourselves. Does that make sense? But we have a partnership with a benefactor who has obviously paid for it. We're licensed, we're open, we're operating, but we are very new. Construction just finished. And so, anything that could help from this funding, we did all of the other goals that are the earmarks that are put out by the application, we match those criteria. We've expanded. We're in Snohomish County. We've expanded the bed capacity of residential substance use disorder treatment by 36 beds. We've met a lot of those earmarks. I just am kind of curious because the timing to me seems a little bit off, because now we're open, we're licensed, but we're still in need of offsetting some of these costs. So I didn't know how we would fit into this opportunity or not.
Edmund, do you have a long-term lease with the contractor who built the property?
We do.
Do you have a purchase and sell agreement for the property, or are you strictly renting?
We're leasing at this time, but there is an intention of converting that to lease to own. And we also received a behavioral health facilities grant for the land. So we did receive that behavioral health facilities grant for the land, which did not cover the cost of the construction for the building at all. It was only strictly for the cost of the land, and so we received that.
So Holman Recovery owns the land. The
Well, actually,
contractor owns the building, and you
Mhm.
guys are long-term leasing the building.
We entered into a partnership. We're both co-applicants for the behavioral health facilities project grant. We both entered in on that. So the other company's name is Grandview Homes. So Grandview and Holman partnered. And Grandview actually put the funding up for the land. So the funding for the land, which was $750,000, that grant went to Grandview, not to Holman, because we didn't put the money up. We couldn't demonstrate payment on that. The Grandview Homes did, if that makes sense.
So these funds do not reimburse already built properties, that it's not a reimbursement program for that. It would need to be for newly built properties.
Okay.
Okay,
I had a
unless
different-
Chrissy or Cammie, if you have anything to add to that.
No, I was gonna say, as we outlined, one of the minimum requirements is that this expands kind of what already exists. So if there is a way that you can increase beyond 36 beds using this funding to kind of add on, that is an allowable expense. But given that kind of where you are today is a 36 bed facility, it would need to be something in addition to that.
Okay, thank you.
Thank you. Chris, I see you've got your hand raised.
Yes. One of the requirement is that the contract for the funding be done by the 2026. Does that mean the program has to open, or the construction and renovation, everything has to be completed by 2026?
The construction and renovation must be completed by 2026, and all funds must be fully expended. I suppose that could mean that the project wouldn't necessarily be opened by then, or fully licensed and kind of down that path. But there must be a plan in place so that we can reasonably kind of know that the project is going to open up.
Yes,
Cammie,
'cause-
oh, sorry, go ahead.
Sorry, yeah, because like we are working on other projects, is once the construction and renovation is completed, then we have to apply for the behavioral health agency or other licenses and for the RTF licensing, and that takes another couple of months. As like we are working on with the healthcare authority on some of our projects. So we just wanted to make sure that if the timeline is set, that the facility has to open by a certain time period.
So for capital projects, the construction has to be completed and the drawdown on the funds has to be completed, as well as the closeout of the loan, so that we can pay the retention out as well. So that is a pretty solid deadline. There's no wavering on that. However, there are lots of times where you'll receive all your other licensing and your opening requirements after that. But for purposes of this funding, you don't necessarily have to be open, but you would have to have the loan closed out. And then you would have to have documentation of what the opening plan is, as Chrissy mentioned.
Okay, great, thank you.
Mhm.
And a question from Providence General Foundation, is the award provided as a lump sum at the commencement of the project, or is the award incremental and reimbursed as expenses for the project are incurred? Robbie?
These funds, unless it's used for acquisition and there's like a one-time payment, say you buy a purchase or you purchase a property and closing occurs and it's for acquisition only and it's $1 million, that's a one-time payment. If it's for construction and associated cost, that is a reimbursable process.
Thank you.
And then also, we do keep a retention amount out of these funds. So that's something I don't think we've mentioned before, but I did get a call about that. So we do have a retainage for capital projects.
Excellent. Thank you so much. Are there other questions? I think we are done with the chat. If folks have additional questions.
I have another question. One was actually just based on the last statement. I'm not familiar with all this language. So what is that? Can you explain what that means, that you keep a part of the funds? Like, I don't understand that part.
So for development, for capital projects, there's always a retainage fee, and the retainage fee can, and what that is developers go out or builders or whoever, and you have a project, you build this project, and then there's documentation that has to be received by the county in order to do a final closeout of the loan. And let's say it's $1 million project, we may withhold 20% of the total funding amount until we receive all of those documents. Or if it's a $300,000 project, we may withhold a retainage amount of $20,000. And so part of that is to really help people get these loans closed timely, because a lot of that, you may be waiting to pay final bills or final construction costs, and you can't pay those until you get the retainage fee from us. So for developing any type of capital project, there is always going to be a retainage fee.
Okay, yeah, that makes sense. Thank you. And then my other question, I actually asked last time, but I wanted to clarify. And it has to do with both acquiring and rehabbing a project. And the reason I want to ask again is because in the grant, it says acquisition costs may be considered eligible if a provider can demonstrate they have the fully secured enough funding to complete any rehab work. So I just wanted to clarify that if we were to acquire a project, would rehab also be considered an expense that can be reimbursed or whatever?
Chrissy, you want me to take that? If you're purchasing a project, let's say you're purchasing a project for $600,000 and rehab is going to be about, you know, 250,000, you're going to have to show us that you have a solid plan and that you have those funds in place, or you can request that amount
Okay.
or the full project amount. Is that what you're asking?
Yeah, so basically, can we ask for the full amount? Or it almost, when I was reading it, what I want to make sure it's not is that you can only have one or the other, because that would make a difference in what facility we go at.
Well, the object isn't really to rehab properties. That's the thing. This is a capital NOFA, and we want to see people acquiring property, or we want to see them adding on. So if you're acquiring a property, that's one thing, that's an eligible use. Rehab, unless you're building and making more space or rehabbing a property to create more space,
Right.
It's not really an eligible expense. So
Right.
if you just want money to remodel, it's not
Right,
going to be
yeah.
a strong enough project to be considered for funding. If you're maybe remodeling because it's, you know, developing 6 offices or patient rooms or something instead of just 2, that might be something to take a look at. But can you apply for this just for rehab? It's really going to depend on what the rehab project is.
Right, it has to do more, yeah, rehabbing because it's not suitable for the purpose. That would be
Right.
it. Okay. Thank you.
Right. And Chrissy, Cammie, did you have anything to add to that? Okay.
No,
No, thank you
your
so much.
answer is right on.
All right, Chris, Chris put his hand back down. So converting an existing office space to become a care delivery space would qualify. Yes, it would. So if it's not currently used to provide services, but as an existing facility, if you were then taking that space and making it a suitable space to deliver services, and it results in a increase in your organization's capacity to provide services, that's allowable. However, you know, if it's, you know, if you're converting an office space and moving a care room kind of to that office space without actually, and then eliminating that original care room, that wouldn't be eligible. We really are looking for that total kind of net increase in your capacity to provide services. Okay, I'll pause for a little bit longer. Any additional questions, comments? Okay, as I said, this session is recorded, will be online. We will also be posting the FAQ. If you have any questions beyond this, please feel free to reach out to snohomishcounty.recovers@snoco.org, and we can respond to you. All right. Thank you all so much. I look forward to reviewing your applications, and I hope you all have a great day. Thank you and Happy New Year.